Welcome to the Victory Education Lounge. I'm your host, Maurice, and today we're diving into part 36 of our series, Nutrition Know-How Dietary Habits for Sickle Cell Health. This series is a treasure trove of information, brimming with insights about how diet can aid in managing and improving the health of those living with sickle cell disease. So if you find this video helpful, don't forget to give it a like and subscribe to our channel for more such valuable content. Also, we'd love to hear your thoughts or experiences related to the topic. Please feel free to share them in the comment section below. Remember, each like, share, or comment you leave not only encourages us, but it also helps this vital information reach the hands of those who need it the most. So let's begin this enlightening journey together. Your engagement helps us reach more people with this vital information. Living with sickle cell disease presents unique challenges, but proper nutrition can play a crucial role in managing symptoms and improving overall health. A balanced diet tailored to the needs of sickle cell patients can help keep the body strong, support the immune system, and even reduce the frequency and severity of pain crises. From hydration to iron management, we'll explore 5 key nutritional strategies that can make a world of difference. We'll also touch on the importance of folic acid, the benefits of antioxidant-rich foods, and the role of omega-3 fatty acids in managing this condition. But remember, nutrition is not a one-size-fits-all approach. It's about finding what works best for you or your loved one. So let's embark on this nutritional journey together, exploring dietary habits that can make a significant difference for those with sickle cell disease. Let's start with 5 key nutritional strategies. First off, hydration is key. For those living with sickle cell disease, maintaining adequate hydration is crucial. This is because sufficient fluid intake can help prevent red blood cells from taking on that sickle shape, which in turn reduces the risk of painful crises. The pros of this strategy are that it's easy to implement, cost-effective, and the benefits can be felt almost immediately. On the flip side, it does require constant mindfulness and may lead to frequent bathroom breaks. Next, we have iron management. Iron is essential for blood production, but for those with sickle cell disease, it's a bit of a balancing act. Too much iron can be harmful, so it's important to monitor intake carefully. The upside is that this can prevent complications from iron overload, but it might involve some dietary restrictions. Thirdly, boosting folic acid intake is a game changer. Folic acid is crucial for red blood cell production, and people with sickle cell disease often need more of it than the average person. This can support healthy red blood cell production and can be easily obtained through diet or supplements. However, it may require supplementation, which should be monitored by a healthcare provider. Our 4th strategy involves antioxidant-rich foods. A diet high in antioxidants can help reduce inflammation and oxidative stress, which are common issues in sickle cell disease. This strategy can be delicious and varied, offering overall health benefits. But it may require significant dietary changes, and fresh produce can be a bit pricey. And finally, we have omega-3 fatty acids. These healthy fats have anti-inflammatory properties and may help reduce the frequency of pain crises. They can be obtained through diet or supplements, offering multiple health benefits. Just bear in mind that fish oil supplements may interact with certain medications, so always check with your healthcare provider first. So there you have it, 5 key nutritional strategies that can make a world of difference for those living with sickle cell disease. Of course, every individual is unique, and what works for one person may not work for another. But with some trial and error and the guidance of healthcare professionals, it's entirely possible to develop a dietary plan that helps manage symptoms and improve overall health. Remember, these strategies are not a cure, but they can contribute significantly to improving the quality of life for those with sickle cell disease. So whether it's increasing hydration, managing iron intake, boosting folic acid, incorporating antioxidant-rich foods, or introducing omega-3 fatty acids into the diet, these strategies can provide a solid foundation for managing sickle cell disease. And that's a wrap on our 5 key nutritional strategies. But don't go anywhere just yet, we're not done. In our next scene, we'll be sharing some real-life examples of how these strategies have helped individuals living with sickle cell disease. So stay tuned for that. Omega-3 fatty acids. These healthy fats have anti-inflammatory properties and may help reduce the frequency of pain crises. Now let's look at some real-life examples of how these strategies have helped individuals with sickle cell disease. First, we have Sarah, a vibrant 25-year-old. Sarah decided to increase her water intake to about 3 liters per day. Over the course of 6 months, she noticed a significant reduction in her pain crises, almost 40%. This goes to show how hydration can have immediate and impactful benefits for those living with sickle cell disease. Next, there's Michael, a 42-year-old gentleman. Michael worked hand in hand with a nutritionist to carefully manage his iron intake. As a result, his ferritin levels stabilized, and he experienced fewer complications related to iron overload. Michael's case underlines the importance of careful iron management in a sickle cell diet. Our third example is Amina, a lively 19-year-old. Amina started incorporating more folate-rich foods like spinach and lentils into her diet. As a result, she reported feeling more energetic, and her blood test results showed significant improvement. This demonstrates the potential of boosting folic acid intake for those with sickle cell disease. Then we have David, a 33-year-old. David decided to opt for a diet rich in colorful fruits and vegetables packed with antioxidants. Over time, he noticed a decrease in fatigue and fewer infections. David's experience shows how antioxidant-rich foods can help reduce inflammation and oxidative stress in individuals with sickle cell disease. Lastly, we have Lisa, who is 28. Lisa started taking fish oil supplements under her doctor's supervision. To her delight, she experienced a decrease in the severity of her pain crises. Lisa's story highlights the potential benefits of omega-3 fatty acids in managing sickle cell symptoms. These examples demonstrate the potential benefits of proper nutrition for sickle cell patients. However, it's important to remember that everyone's needs are unique. What works for one person may not work for another. Let's dive deeper into each strategy. First, hydration. Keeping your body well hydrated is a simple yet powerful way to manage sickle cell disease. Aim for at least 8 to 10 glasses of water per day. You can also increase your fluid intake by enjoying herbal teas, fruit-infused water, and water-rich foods like cucumbers and melons. Next, let's talk about iron management. It's crucial to maintain a balanced iron intake. Consuming foods rich in iron, such as lean meats, beans, and fortified cereals, is beneficial. However, remember to monitor your intake to avoid excess. Consulting with a nutritionist can provide valuable guidance in this area. The third strategy involves boosting your folic acid intake. Incorporate more folate-rich foods into your meals. Spinach, lentils, and fortified cereals are excellent sources. If you struggle to get enough from your diet, discuss with your healthcare provider about the possibility of taking a supplement. Moving on to our fourth strategy, incorporating antioxidant-rich foods. These foods combat inflammation and oxidative stress, common issues in sickle cell disease. Fill your plate with colorful fruits and vegetables, nuts and seeds. Berries, leafy greens, almonds, and sunflower seeds are all excellent choices. Lastly, we have omega-3 fatty acids. These healthy fats found in fatty fish, flax seeds, and walnuts can help reduce inflammation and may decrease the frequency of pain crises. If you're not a fan of fish or nuts, consider an omega-3 supplement. However, always consult with your healthcare provider before starting any new supplement regimen. Remember, these strategies are not one-size-fits-all. They are starting points, suggestions to inspire you to take control of your nutrition and find what works best for your body. It's always important to listen to your body and consult with your healthcare provider when making dietary changes. Hydration. Aim for at least 8 to 10 glasses of water per day. Herbal teas, fruit-infused water, and water-rich foods can also contribute to your hydration levels. As we wrap up, let's quickly recap the key points we've covered today. Proper nutrition can be a game-changer for managing sickle cell disease. We've highlighted 5 key strategies: staying well hydrated, careful iron management, increasing folic acid intake, consuming antioxidant-rich foods, and incorporating omega-3 fatty acids in your diet. Each of these strategies can significantly impact the quality of life for those with sickle cell disease. We've also shared some inspiring real-life examples of individuals who have successfully implemented these strategies, from Sarah reducing her pain crises through increased hydration, to Lisa experiencing less severe pain crises with the help of fish oil supplements. However, it's important to remember that everyone's needs are unique. What works for one person may not work for another. Before we conclude, I want to emphasize that the information provided in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician or qualified healthcare professional, especially when you have existing health conditions or are taking medications. While proper nutrition can be a powerful tool in managing sickle cell disease, it should always be part of a comprehensive care plan developed with your healthcare team. Thank you for joining us today at the Victory Education Lounge. If you found this information helpful, please like, share, and subscribe to our channel. Your support helps us continue providing valuable content to the sickle cell community. Until next time, nourish your body, fuel your health, and stay strong, healthy, and see you next time in the Victory Education Lounge.